morning, everyone. Thank you for inviting me this week. I go to GW. I've only been in DC for a couple of weeks, so this is really crazy for me. And as Lauren said, please bear with me as well. HIV was something that was normalized in my household. Even before I knew what it was and what I was doing, I was a sexual and reproductive health rights activist. Reflecting on my childhood, I remember conversations involving words and phrases like protection, highest infection rates, free testing, and Black community. A memory that strongly stands out to me is when I was 7 years old, I would rummage through my mother's stuff. Somehow in the midst of my exploration, I always ended up in the same drawer in her nightstand, and this drawer always was filled with condoms and lubricants. At this age, I had somewhat of an idea what I encountered, but I was too young to understand everything. However, I began to understand the day my brother and I got a rare opportunity, especially for an 8- and 9-year-old, to ride a Housing Works float with my mother and her colleagues and the annual African American Day Parade in New York City. For those of you who may not know, which I doubt, Housing Works is a nonprofit organization with the mission of ending both homelessness and AIDS through direct service and advocacy. I remember sitting on the edge of the float with my oversized yellow shirt that read in big, bold, black letters, safe sex, digging my hands in the container of condoms and throwing it out into the crowd. Sometime later, some float rides later, and some getting used to rummaging through that drawer, I learned what was my mother's driving force behind her involvement in this work, which too would become mine later. Growing up, my mother was a daddy's girl. My grandmother was a Jehovah's Witness, and my grandfather was a devoted father and a Black Panther. For a Black man living in Brownsville, Brooklyn, that was a rarity. But as his fro grew, so did his addiction to drugs. And for the next 30 years of my mother's life, she would have to battle the pain of searching for her homeless, doped up father, who we would find out later was infected with HIV, as well as battling her own drug addiction. It wasn't until the day he died that she told me he had been in the hospital and passed away from an AIDS-related illness. But as I stared into her eyes and I searched for the truth, I saw a look of absence I had never seen before, but was suddenly replaced by an even stronger burning passion. For the next couple of weeks, Luther Vandross's Dance with My Father would fill the silence in my home and emptiness in my mother's heart. Well, at least up until her next project. It was then at the age of 10 that not only did Granddaddy Frank become my inspiration, but so did my mother. Fast forwarding to middle school, I can recall the little sex education that I received as a 7th and 8th grader. Each year we would get notice that regular class would be paused and Mount Sinai's adolescent clinic would be coming in to talk with us about sexual and reproductive health. This is usually when the teacher would give us forms for our parents and our guardians to sign to opt into the only sex education that we would receive throughout the school year. I only received 4 classes and probably 12 hours of sex education, which ultimately fell short of New York City's sex education mandate. My friends and I discovered that most parents sign the document to sort of release themselves of the responsibility of having to have the typical birds and the bees conversation with their children. Clearly my mother signed it, but even she, who was fairly liberal, failed to discuss some of the things that I learned in these classes. Surprisingly, many of the kids' parents who seemed very liberal didn't sign it. And to be honest, these were the kids that were in desperate need of this information, primarily because they were also the kids that were engaging in sexual activity in the schools. When I got into high school, I found myself involved in what I call a bunch of mess. And before I knew it, I was at Planned Parenthood, signing up for emergency Medicaid to carry out an abortion. Later, I realized that the same act that got me pregnant also put me at risk for HIV and other STIs. A part of me always felt that if I had adequate, comprehensive sex education, and if I had a more open and trusting relationship with my mother, then I would have made healthier decisions regarding my sexual health. However, what I went through compelled me to help others, so I joined YCHAC, formerly known as the Young Women of Color HIV/AIDS Coalition, during the summer before sophomore year of high school. As a part of the outreach, we would host safer sex education parties, health summits in communities where HIV/AIDS rates are high, and lobby the city council members like Letitia James and Jamani Williams about the importance of implementing the HIV/AIDS education in public schools. Being involved in this program and in this work has helped bring my mother and I closer by allowing us to bond over similar passions, while simultaneously opening the door for us to have a different type of dialogue, one that I stress that every child should have with their parents. We now have in-depth conversations about sex, contraceptives, the male and female reproductive system, and even the social, economic, political, and cultural factors that this disease is embedded in. Due to this work, and to my surprise, I became that girl. Almost all of the networking I did amongst my peers was founded on the basis of the advocacy work that I do. This was also when I realized the extent of the misinformation that was circulating amongst my peers. For example, they didn't know what an STD stood for. They didn't understand that HIV was a precursor to AIDS. And they thought that douching to flush out sperm after having unsafe sex would prevent pregnancy. In schools, my peers, black, white, it didn't matter, all approached me about STD systems, nearby clinics, free testing, and even for condoms. In spite of the safe place my school tried to establish in the basement where nobody noticed and nobody really had access to. While it was great to have condoms available on campus, the location was not ideal and only served to further stigmatize safer sex. Teachers was also left off the hook so that they did not have to deal with providing a safe place or being the adult that we students needed to come to for information and support. My peers and I wanted adults we could speak to. And my high school was also required that sophomores take health class, which was supposed to cover sexual health, substance abuse, and mental health. However, the class was lackluster because it was taught by the gym teacher, who had little to no knowledge in these areas. And when it came time to talk about sexual health and STDs, my gym teacher just showed us a movie about a gay man having to come to terms with his sexuality and having HIV. He also went as far as stating that one could tell if someone had HIV because they would have lesions, and most likely they are the homeless people that we encounter every day. My friends, I'll never forget this, I always tell the story. My friends looked at me to agree, like just like that, gave me a little look like that. While I was embarrassed for him, I respectfully objected, and he allowed me to take over for the rest of the class. I am proof that if relationships are built and maintained between young people, their parents, teachers, and community leaders, then it's possible for you to effectively combat the HIV crisis. It is vital that in combating this disease, adults, including parents, learn to build youth-adult partnerships and ensure that comprehensive sex education is prioritized so that youth have the correct information to make healthy decisions regarding our bodies. With your leadership, I hope that one day we will have a national campaign focused on young people and HIV, meeting them where they're at, and including resources for events like spoken word, parties, workshops, festivals, and any other kind of forms of outreach. Above all, we need leadership from the top. If the First Lady could talk about physical fitness and build a garden at the White House, and if Obama could stress the significance of fatherhood, then I feel that the first family should talk about the importance of sexual health. They are parents of 2 young daughters who are nearing the age of where HIV infections are high in young women of color. It can't just be normalized in my home. We need them to be role models too. With that said, thank you for allowing me to speak today. And like Lawrence mentioned, hopefully this is not the last time that youth are allowed to speak at a PACHA meeting. Thank you.